Cassie Adams, and this is my neurological assessment for an advanced health assessment at the University of Charleston. Let's get started. So first, we're going to check cranial nerve 1, which would be the olfactory nerve. I'm going to start by having you smell a couple things, and you tell me what you smell, okay?
All right.
All right. Product number 1, nostril number 1.
Orange.
Very good. Okay. I'm going to check if this is a different symbol, okay?
Right. Cinnamon.
Very good. So he has correctly identified both scents, so we can say that cranial nerve 1 is intact. Cranial nerve 2, the optic or visual acuity, we would normally check with the Rosenbaum chart. I do not currently have one. But I would have him cover his left eye, read the smallest line possible, and then cover his right eye and read the smallest line possible, and then read the smallest line with both eyes open. Cranial nerve 2, optic, and 3, oculomotor. We're going to check the shape and size of his pupils with a pen light. I ask you to open your eyes and just look directly at me, okay? Or just look straight up. Open your eyes. Open both eyes. Very good. Very good. Pupils are equal and reactive to light, measuring at about 3 millimeters apiece before contraction. Next, we're going to do the oculomotor, trochlear, and abducens nerve. And I'm going to have him follow my finger with just his eyes only. You ready? Just your eyes only. Okay. There you go. So he did follow all of the cardinal movements correctly. And he did follow my finger to the center of his nose with his eyes. Next, we're going to do the temporal and masseter muscles, and this checks for the trigeminal motor nerve. We'll feel right here at his temporal and ask him to clench his teeth. Clench and hold. Very good. I can feel that his muscles tighten, and it is as expected. Next, we're going to move to light sensation, light touch sensation on his forehead, cheeks, and jaw. I'm going to ask you to close your eyes, and you let me know when you feel touch, okay?
Now. 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 Now.
Very good. You can feel all of my touches. We would next check the corneal reflex, but he has declined for me to touch his cornea, so it is most likely intact. Next, we're going to check the facial cranial nerve, which is cranial nerve 7. I'm going to ask you to raise your eyebrows. Very good. Can you frown? Smile. Show me your teeth. Puff your cheeks out. Very good. No asymmetries noted, and he is able to follow all functions. So next we're going to check the acoustic nerve. I'm going to use the whisper test. I'm going to whisper behind you in your ear, and you tell me what word you hear, okay?
Blueberry.
Very good.
Soccer.
Very good. So he was able to hear both of my words and repeat them to me correctly. So next we're going to check the glossopharyngeal nerve and the vagal or vagus nerve. And we usually also check voice quality, but since he's been talking to me, we do know that his voice quality is good. I'm going to look into his mouth and have him say ah, and observe his palate for moving, his soft palate. So bring up, say ah. Very good. There is movement in the soft palate. His voice does sound normal. Next, we would check gag reflex with a tongue depressor.
That won't be needed.
I don't need to check gag reflex, I promise he's got one. Normally we would do that with the tongue blade and touch the back of the throat or the sides of each of the throat. So we've inspected his tongue and his mouth. Can you stick your tongue out? It is symmetrical. Can you move from side to side? Very good. And that checks the glossopharyngeal nerve as well. So next we're going to check his spinal accessory. I'm going to place some pressure on his shoulders and ask him to shrug. Very good. Relax. I'm going to place my hand on this side of his head and ask him to turn his head against my resistance. Very good. And we're going to do this side. Very good. He is strong on all fronts. And we have checked the movement of his tongue. So next we're going to check his upper extremity coordination. I'm going to ask you to tap your hands on your thighs and then the backs. Very good. He does pass that. I'm also going to ask you to do it with your toes as well. Can you just touch your toes to the floor real quick? Very good. Can you run your right heel down your left shin? Very good. Now can you move your left heel down your right shin? Perfect. He does show great coordination in his upper and lower extremities. So now we will move on to his gait. I'm going to ask you to walk across the room, but I'm going to ask you to do it using heel to toe fashion.
Alright.
While he's walking, I will observe his normal arm swings as well as his balance and his posture and his coordination. And it does seem well. Very good. Now, can you hop in place? Very good. Thank you. If it was an older patient who wasn't able to hop in place, you might would use a stool and have them to step up on the stool with each leg to assess that as well. So he has, we've checked his gait and his hopping in place, his balance is very good. So next we're going to do his Romberg and pronator, meaning that I'm going to ask you to stand with your eyes closed, with your feet together, and keep your eyes closed, and your arms at your side. During this time, we're going to observe his balance. We're going to observe if he sways back and forth, or how well if he has any unbalanced or uncoordinated movements, and he seems to be doing well. Now, can you stretch your arms out in front of you and place your palms up with your eyes closed? Now stand there. If this was an elder patient, you would want to be ready to catch an unsteady patient, but he's doing well. Thank you. You may seat. Very good. So we observed his body during movement, and we've also observed his body at rest, so we do not notice any abnormalities there. I do not notice any tremors or tics in his regular gait, his walk, or his restful movements. His muscle size and contour seems to be good. He has good tone. And I'm going to ask him to grasp my hands. This one. Very good. This one. Very good. Let me see this leg. Push against my foot. Very good. This one. Very good. He has great tonality and he is very strong. So now we're going to do sharp and dull testing. I'm going to ask him to close his eyes, and I have a sharp object and I have a dull object. And I'm going to touch him with either one, and I'm going to have him explain to me if this is a dull sensation or a sharp sensation. Ready?
Sharp. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull.
Very good. He accurately identified whether it was a sharp or a dull touch. Next, we are going to compare symmetry. Can you hold your hands out for me? So both of his hands are symmetrical, his shoulders are symmetrical. I do not know any other asymmetries in him. So next I'm going to do the proprioception. I'm going to ask him to close his eyes, and I'm going to move a finger up or down, and you tell me which position, okay?
Up. Down. Up. Up. Down.
Okay. Can I see this leg?
Up. Down. Up. Up. Up.
Very good. He did appropriately recognize each position of the finger and the toe. Vibration, I would check if I did have a tuning fork. I would strike it in place at every joint and let him tell me when the vibration had stopped, but I do not have one of those. Next, I'm going to have him hold out his hand, and we're going to check stereognosis and graphesthesia. I'm going to place an item in your hand, and you tell me what this item is, okay?
Coin.
Very good.
Clip.
Very good. Next, I'm going to draw some numbers or letters in your hand, and you tell me what that number or letter is, okay?
A.
Very good.
3. G.
Let's try it.
5.
Yes, very good. So he was able to tell me each item and also tell me which letters or numbers that I wrote in his hand. So he did very good with that. I'm also going to touch 2 points on your body, and you tell me with your eyes closed where I touched, okay? Very good. Very good. Now I'm going to touch 2 places simultaneously. You can just verbally announce where I'm touching you, okay?
Arms. Arms. Legs.
Very good. Next we would do the meningeal signs. I do not have a flat surface that I can check these, but I would check the Brzezinski's, the Koenigs, and the straight leg reflex. And Brzezinski's, we would flex his neck forward and watch for any hip flexion or knee flexion, and that would result in a positive sign. We could also check just nuchal rigidity if his neck was stiff, moving it forward to see if there was any pain with flexion. The Koenig test, we are going to flex the hip and the knee, and then we're going to straighten it and watch for pain on straightening. And then the straight leg reflex, we would lay him flat, lift his leg as it's straightened with his foot flexed, and look for any pain that way. Lastly, we would also have him check the winging of scapula, so we would have him put his arms out in front of him and push against the wall and observe his scapula for the winging effect. Last, we would do deep tendons, so we would check the bicep tendon. I don't have a reflex hammer, so I'm just going to tell you how to do it. We would hold his arm out, and we would check the bicep tendon, and then we would strike the thumb. Next, we would check knee-jerk reaction. We would strike right here below the patella and watch for leg movement. Same over here. And then we would also check the abdominal reflex, meaning that we would mark an X on the abdomen upward toward the umbilicus and watch for the twitch. Again, I don't have any surface to lay him down. But everything else looked really good, and I appreciate you viewing my neurological assessment, and thanks for participating. It's fun. Thank you.